Hi, my name is Andrea Hall, and I would like to present my research proposal, Support Group Attendance Impacts Post-Bariatric Weight Loss Success. Obesity is a worldwide epidemic. In 2016, the World Health Organization found that 39% of Americans are overweight and 13% are considered obese. Over 2 million people die each year from obesity-related diseases. Medical costs are rising and estimated at $147 billion per year. Traditional treatment for obesity includes calorie restriction, physical activity, and medication. These methods do not support long-term weight loss success. One tool that is found to be successful is bariatric weight loss surgery. Most bariatric weight loss surgery patients successfully lose 50% of their excess body weight and keep it off. However, 10 to 20% of those surgery patients regain weight at 6 months post-operative. Why do they regain? The factors are varied and have not been studied thoroughly. The factors being looked at in this research study are social and emotional support and length of post-operative interventions. Social and emotional support is defined as attendance at a monthly support group session. Why does this matter? Weight regain can bring back previously eliminated weight-related health issues and send patients back into the obese category. In order to study these factors, a research question has been posed. Is the frequency of support group attendance and the percentage of excess weight loss post-bariatric surgery positively related? The null hypothesis states patients who attend more than 6 support group meetings will not see an increase in total excess weight loss. This proposed research study will reject the null hypothesis. What does the research say? In the past 5 years, research has been focusing on what factors most influence bariatric weight loss success. The factors most studied were physical activity and diet. However, the underlying theme of the research reviewed is that emotional and mental support has a positive impact on weight loss retention after bariatric weight loss surgery. These factors need to be studied in more detail. Many researchers found that the type of intervention and length impacted weight regain. Robinson and others found 5 predictors of weight loss success: pre-surgical factors, post-surgical psychosocial variables, support groups fall into that category, post-surgical eating patterns, post-surgical physical activity, and follow-up at post-surgical clinics. Patients who regularly attended post-surgery support groups doubled their chance of weight loss success. Sharman's study supported the theory that patients view peer support as a positive influence on weight loss. In 2013, a study showed patients with little or no follow-up after surgery have less weight loss success and tend to regain. In a large hospital setting, an 8-week social support group using a commercially produced cognitive behavioral program called Back on Track was conducted. Members of the group found that peer support was a substantial motivator to lose regained weight. Not many of the reviewed studies looked at long-term aftercare support. This research proposes to explore further the impact of emotional support on long-term weight loss success in bariatric surgery patients. This study will use an experimental design with a control group and treatment group. The control group will receive typical standard of care for patients 6 months post-surgery. This standard of care will include 6 monthly follow-up appointments and written nutritional guidelines. The treatment group will also receive the typical standard of care in addition to monthly attendance at support group meetings. The Back on Track cognitive behavioral program will be used to facilitate group meetings. A sample population will be recruited from Baylor Scott & White Medical Center for bariatric treatment. Patients will voluntarily sign up. After volunteering, researchers will contact volunteers to go over inclusion criteria. Inclusion criteria: 6 months post-op, willing and able to attend monthly meetings, between the ages 25 to 55. Men and women both will be recruited for this study. Hospital Review Board guidelines will be followed. Belmont report principles will be closely followed. Once included in the study, subjects will come in for an initial visit to sign informed consent and go over study information sheet. No subjects will be harmed, as both groups will see the standard of care typical for bariatric weight loss patients. A G-Power test will be used to determine sample size. A total sample size of 128 subjects will be recruited. Due to attrition of possible subjects, a total of 150 subjects will be recruited. A paired t-test will be used to compare the mean weight loss of both sample groups. After determining mean and standard deviation, the t-test table will be used to find the critical value of t. A p-value of p less than 0.05 will be used to determine level of significance. If the level of significance is lower or less than 0.05, the null hypothesis will be rejected. Comparing before and after weight to determine weight regain will also be analyzed. There are limitations to this study. The sample size is relatively small and therefore may not reflect a true representation of the population, and the study is directed at a very specific population, people who have had gastric bypass surgery, and this may not generalize to a bigger population. Recruitment may be difficult due to the using of a volunteer method to recruit. There could possibly be a high dropout rate as the study is at least 6 months long. Data collection may be small due to the small sample size, which could skew statistical results. The support group also might be more motivated to follow guidelines for healthy eating as they will be checking in with a group each week. This could influence the treatment group data. Although there are limitations to the study, valuable information regarding extended aftercare in the form of support group meetings will have a positive impact on bariatric weight loss surgery success. Obesity levels are at an epidemic high in the United States. Medical costs are rising due to the obesity-related illnesses. However, bariatric surgery is an effective tool for weight loss, but 10 to 20% of those post-bariatric surgery population will regain their weight. This could cause them to re-enter the obese category and see the return of obesity-related illnesses. Current research fails to look at long-term aftercare post 6 months. Bariatric physicians offer limited aftercare, usually in the months directly after surgery. The proposed study will show up to 12 months aftercare will decrease the chance of weight regain in bariatric patients. Findings will encourage bariatric physicians and clinic settings to increase aftercare support. In conclusion, long-term implications would lead to fewer patients returning to the obese weight category, fewer obesity-related illnesses, and reducing health costs. Thank you for listening to my presentation.